Good afternoon to everyone, and welcome to today's session. My name is Ray Cabrera, and I am the director of the Upward Bound program here at the University of South Florida on our Tampa campus. Our program is a federally funded program where we assist high school students here in the Tampa Bay area who are going to be the first in their family to go to college. So our program provides resources, support to the student and the family throughout their entire time in high school to ensure that they're successful academically, personally, socially, and are ready for college. So I am grateful to be here today and be in this capacity to serve as moderator for today's session. So just to kind of give you a flow of what today will look like, the purpose of today's workshop and session is a majors exploration. I know for myself as a college student a long time ago, I stepped into that experience not really knowing what I wanted to do in life. I'm originally from New Jersey, went to school at Rutgers University, and to be honest with you, I was just happy to be in college. I was the first in my family to go to college, and having a path, having direction. For me, the win was getting in. But once I got there, I had no plan. In all honesty, so I'm grateful for opportunities like this where we can kind of come together as a USF community to learn what's happening right here in our own communities, but also opportunities for each and every one of us. And what I've learned throughout the years is that it starts with networking and getting to know one another and meeting people and coming out of our comfort zone. So forums like today allow for that opportunity. So once again, glad to be with you all. Why don't we start off first with our our introductions of our colleagues and our professionals that are joining us today. We have both the University Area Community Development Center with us, also Moffitt Cancer Center, who are joining us for today's discussion. So why don't we start off with Ms. Janet Palencia with the introduction of yourself. Tell us a little bit about you.
Okay, thank you so much, Ray. For me, it's a privilege to be here today. And as you can see, I'm much older than you college folks, but I just wanted to let you know that I've been working at Moffitt for 24 years now, I think. And throughout those years, all I knew was that I wanted to always help people, and that I had inside. I wanted to join people together. I wanted to see a need and get to know someone that could fulfill that need and to be able to join them together. And that's what I'm going to talk about. I was asked to bring in some experiences, and that's what I have for you today.
Thank you, Ms. Janet. Diana?
Let me unmute myself. Hi, everyone. My name is Diana Diaz. I am the Career and Engagement Manager at University Area CDC. It is not the Center for Disease Control. It is a community development corporation right down the street from USF, actually. And I may look younger, but I am learning, because I do work with college students in my current role, that I am older compared to them. But I am a graduate of USF, and I do have my bachelor's and master's in public health. So I was also the first in my family to go to college. So I have that in me as well. And I'll talk to you a little bit more about the university area community and how you can get involved right here in your community right now.
Thank you, Diana. And Topher?
Cool. Hi, everyone. So my name is Topher Larkin. I work at Metro Inclusive Health, not Metro, the phone company, but Metro Inclusive Health here in the Tampa Bay area. We are a health and community center, ranging from everything from HIV prevention, education, LGBT services, behavioral health, basically all the needs that can address the community. And I think what I am here for is to kind of solidify, the helping people as your passion, but also in the fact that what one does in their careers can be transferable to whatever else you want to do. And that's kind of been the theme of my career, actually.
Great. Thank you so much, Topher. Given that we have a nice intimate group, why don't we do this? Let's go around the room and get a feel for U.S. students in terms of where you're at in your USF experience. Maybe tell us what your projected major is, or what that major already is at this point, and maybe what you hope to do long term with that. So I'm going to pass the floor to Joy Cadman. If you don't mind unmuting, tell us a little bit about yourself.
Hi, my name is Joy. I'm a freshman here at USF, and currently I'm an undecided major, but I'm looking to either the interdisciplinary social sciences, they have a bunch of different concentrations under that, or hospitality management.
Awesome. Kayla?
Hi, I'm Kayla. I'm also a freshman. The major that I'm leaning towards and like planning on declaring is health sciences, which with a concentration in biological health sciences. And I hope to be a PA in pediatrics.
Great. Mandy?
Hi, my name is Mandy. I am a freshman here at USF, and I am a public health major, and I hope to become a pediatrician when I grow up.
Great. And Simone?
Hi, my name is Simone. I'm a first year. I'm undecided health sciences, but I'm leaning towards biomed.
Okay, great. So once again, welcome to all. And that's college. Some of us know kind of what our plan is going to be. And some of us are in that exploratory phase where we're trying to see what's next for us. What are we passionate about? What are we good at? What do we see ourselves doing in the short term? And the other beauty of preparation for work and working in general is that as we evolve as people, our interests also evolve alongside with it. So it's not uncommon for us to even major in something now, and then later on in life, you might pursue other passions as well. It's all a part of kind of us as people, as we experience different things, as we start various occupations. It sort of leads us to kind of fine tune what it is that we want to do. So glad to have all of our students with us today. So as we mentioned, we're going to start off today's discussion with Moffitt Cancer Center. So Janet will open us up and tell us a little bit about all the great work being done there. As I shared as when we opened up, my mother had lung cancer just a few years ago. Amazing treatment at Moffitt Cancer Center. Can't say enough of the good work that's done there and just the great care that she received. So Janet, please, share all the great things that you do, as well as all of our colleagues over at Moffitt Cancer Center.
Okay. Thank you so much, Ray. I just wanted, what I wanted to share with you today was that I love working at Moffitt. As I mentioned before, I've been working at Moffitt 24 years. When I first started out, my job title is Senior Community Outreach Worker. And back in the days, I never, even when I applied, even when I was told about my position, I didn't know exactly what a community outreach worker was. So I went into a job interview. I knew I just wanted to help people, and this door opened, and I wanted to help people. And as I helped people, it's like, how do I tell you? You take one step at a time, and it's a daily thing, and you help someone, and then you help the others. I started working with the mobile unit. We used to have a mobile unit. They used to do mammographies out in the community. So I would do all the registration, work with the community health centers, and bring it all together. Then we would go out to the farm and work with the farm workers. It was a grant at that time. When I did that, I was helping the women register them in and for them to have their mammograms. These women didn't know anything about having their mammograms done, a yearly mammogram. And I started building and seeing where it was changing after 1 year, after 2 years. Now I'm not calling them, they're calling me. It's time for my mammogram. And the whole community started changing in that area where they were knowing that at the age of 40, they needed to have a mammogram. Well, when everything ended back in 2011 and everything went from analog to digital, my job title changed. At that time, I was going out into the community and doing workshops out in the community. Right now, to this day, we have 9 workshops. We do health basis, we do breast cancer awareness, we do prostate cancer, we do 9 different types of cancers, which have screenings. We go out into the community and do these. I love the networking, going into churches, going into schools, adult education schools, working with the library, working with, like today, I had, I did a workshop for the Pinellas County Wellness. I do workshops with different churches. I do English, because I'm bilingual, I could do English classes, I could do Spanish classes. And also I organize health fairs out in the community. And this is stuff that I just love to bring people together. And throughout the years, it's grown. You work with different agencies. I'm part of, right now I'm a little backed off, but I'm part of the Hispanic Sheriff's Advisory Council. I worked with them also. The reason I say that I'm a little stand back is that I had a death in my family after taking care of my dad for the last 23 years. He just passed away, and passed away last year. So I'm still, working, doing everything. And just because of the pandemic, a lot of things have changed. Before, I used to go personally to all these places. Now, most of my work is done from the house. I do these workshops from home. And so many things have changed. But you know what? When you love something and deep down in your heart, you love them, you will do whatever is necessary to fulfill that which you have within you to go out and do change. You reinvent yourself. You say, okay, if I can't do it this way, I'll do it another way. But it's always to the benefit of the people and to the benefit of the community. Besides working, I organize events, out of virtual events now. Before, they were in person. Now they're virtual, so I could do a pastors' meetings and bring all the faith leaders together and have different conversation. Another thing that I love is bringing the faith community, and so that they could meet the social services community, so that when a pastor needs help, they already, because they've met someone else in a meeting, they could hook them up, and they could be like raising their arms so that they could get more help. So these are all different access of the type of work I do. It's never a dull moment. One day I may say I'm doing a radio interview, and the next day I'm talking to a group of people that have come out of incarceration, and I'm doing a health education for them. The sky's the limit. I have been, when we started this program that I started working with the Hispanic community was called Yo Me Cuido. For those that know Spanish, means I take care, which means I take care of myself so that I could take care of my loved ones. And this program is started in 2011, and by 2013, it was only my manager, myself, and my coworker, but we made it. We got a recognition from the White House. And through all these things in life, like Ray said, you might start someplace and totally find yourself 2, 5, 7 years later, totally in a different area. But if your heart is for the people and to help, and the healthcare, Moffitt Cancer Center has, is humbling, because I told Ray, I see how he says that his mother got very good care. That's all I hear out in the community. But many times I'm the one that hears it. Might be years later, when I meet somebody at a health fair, my doctor treated me so well at Moffitt. It's a major, perfect place to work. I tell you, if you want, you could go through our website. It's Moffitt, MOFFITT.org. And you could check the website out. If you, the main number for Moffitt, I have it here, is 1-888-663-3488. Also, if you want any volunteer to volunteer at Moffitt, you could speak with Amy Green at 813-745-1661. Or call the main number at Moffitt and ask for volunteer services. There are always volunteer opportunities out in the community and at Moffitt. And this is all I have right now.
Great. So at this time, I'm going to open the floor to students that might have any questions. Ms. Janet, thank you so much for that information. When I hear you speak, I hear a lot of awareness, and you're someone that brings awareness to our community, that oftentimes there's barriers to getting access to help, and you're able to go into the community and to a variety of different settings and bring that message to those that might need it or know that these resources are available. So thank you for the work that you do. Students, any questions you have in general about Moffitt, about the work that Ms. Janet does? And I know based off of just majors that you've mentioned, public health, I think is one of those that ties right into the work being done there. So students, if you have any questions, feel free to raise your hand and I'll acknowledge you, or feel free to also put it in the chat. So, Ms. Jenna, while they think about questions, I'll start off with one. What is something? What is the most difficult thing in your role, and what is that thing that brings you the most joy?
The most difficult. Oh God, I can't. I don't know, but what brings me more joy is, like I mentioned before, being able to bring people together. I have an example of that. Several years ago, if I could give an example, several years ago, I got connected, a radio host connected me and wanted me to meet someone. It was a young woman that had cancer. And so I met up with her at a local restaurant by USF, met with her, and several years, she called me Mama Bear. And several years later, she's always kept in contact with me because she had no family here in Tampa. And this has brought me much reward and happiness, is that so many years later, she still calls me up. We did a Facebook Live, and she wanted to give her testimony on how we were able and how Moffitt was a family to her. And that really touched my life. When I saw the video that she put out, I just had to get up from the computer and step away because it so touched me. So things like that, being able to be the person to help and connect with services has been a very rewarding for me and for the people that get touched.
The last question for me, and I know health in general is always one of those sensitive times in life, right? Where it brings a lot of hardship, stress on the patient as well as the families as they go through, the various illnesses. How do you deal with that in general, or how do you see the staff at Moffitt dealing with that? That oftentimes it's you're encountering people sometimes at their worst, but there's still that hope that's provided through the work that's done. So talk to us a little bit about how you manage that, because I would think that's pretty challenging.
Well, with my job, I'm not in the hospital. Like, I work from, I have an office at the research center, and then from there I go out into the community. So I'm not in the hospital, let's say, like all day long or everything like that. I usually meet the people out in the community, and when I have to meet with them before the pandemic, that I could go with them to some of the doctor visits, I would join them there. It's not easy. But when you have compassion, you know that you do the best you can, and you try to live with no regrets, that you try to help a person as much as you can that you're able with. And that's how I deal with it, that I know that I've done the best.
All right. Well, great. Well, students, if you think of any questions along the way, feel free to either put them in the chat, or we can acknowledge those a little later on in today's presentation. But we're going to go ahead and welcome on in our colleagues at the University Area Community Development Center. And Diana and Topher, I have a presentation here, so I'll go ahead and share that. And feel free to just let me know when you want to move on to the next slide, or let me make sure can everyone see that?
Yeah, it's showing up.
You can see it, okay.
Yeah.
Let me just go to the beginning. There we go. All right, so the floor is yours, Diana.
All right, hi everyone. Like I said, my name is Diana. I am the Career and Engagement Manager at University Area CDC. So our address is right there on the screen, and we are located, if you're familiar where the Walmart on Fletcher is, we're like 30 seconds from there. So I kind of put this together to keep me on track and not ramble too much, because I have a tendency of doing that. So you can go to the next slide. Thank you. Okay, so our mission at University Area CDC, we are a 501c3, which means we are a nonprofit. We're a public-private partnership whose mission is children and family development, crime prevention, and commerce growth. Our primary focus is the redevelopment and sustainability of the at-risk areas surrounding the Tampa campus of the University of South Florida. So I know that I think everyone said they were freshmen. So if you're not from Tampa or familiar with the area, there's USF and like Temple Terrace and all that, but then you have this other area down the street from USF, which historically hasn't been the best. So there have been issues like high crime, high school dropout rate, low employment, things like that. And really, our mission is to make this community a great place to live for the people who are already here. So all the programs and services that we're pouring into this community, while they are open to anyone, so we don't really turn anybody away from using the services, but with us being located in the university area, it makes it more accessible to the people of this community. And so we really, our focus is making this community a great place to live for them. And I'll talk a little bit more about how we're doing that. You can go to the next one. So when we say the university area, what does that even mean? So our primary service area is the university area, which we define as Bears to the north, Bruceby Downs to the east, that's the street that borders USF, Fowler to the south, and 275 to the west. Secondary, we service zip codes 33612 and 33613, but like I said, we really serve all of Hillsborough County. We even have some people who come from Pasco County, but our majority focus is this area. Next. Here's a little snapshot of our community. So as you can see what I was mentioning earlier, it's a pretty big melting pot in this area. So we do also have a high refugee population, a high immigrant population. And as you can see, our unemployment is quite high, poverty, adults with no high school diploma, no vehicle, and renter-occupied housing, that's a big one. So almost 90% of our residents live in rental properties, which when you're trying to create community, it's really hard to do when people don't own property, because you can't really, they have no stake in the community. They don't feel like it's theirs, because technically it's not, they're renting. And also when if you're not familiar with what's going on right now, rental prices are skyrocketing. So we have people in this community being charged like $1,300 for a 2-bedroom, 2-bath apartment, which is wild, especially considering that a large percentage of our community makes less than $15,000 a year. So you can imagine how tough it is to survive on that. Next. So some ways that we are trying to make a difference in this community. So this little image here, it's really, our programs and services are the roots, and then the community is the beautiful tree that will flourish from this, ideally. So some of the programs we do have our Prodigy Cultural Arts Programming. So that is free art classes for kids ages 5 to 17 in the areas of, we have music, drums, guitar, all of that stuff. And it's not just arts, it's teaching life skills through the arts. So the youth are learning things such as anger management, communication skills, things like that through the arts. And also it's giving them an extracurricular and something to do after school, as opposed to just going home or being out in the streets, unsupervised, things like that. Youth and adult education. So within our building, we do have a Head Start program, which is kind of like pre-K, if you can think about it that way. So for ages 3 and 4. And we also have ESOL and GED classes within our building as well. Health and wellness. So we have our Get Moving program that offers free health and wellness programs and services to our community. And so mostly, like for kids, we have karate, soccer, basketball. We have nutrition classes. For the adults, we have twice a week boot camp and yoga for free. We have pickleball, which is kind of like tennis, but not as intense. And all of these programs and services are free to the community. Around crime and safety, we are doing things. So usually when people think crime and safety, it's like stopping crime and people who are doing crime, but we really look at it more so from an environmental perspective. So how is the environment influencing crime and safety? So things such as lighting. There are a lot of light poles that come nighttime, they're broken, they're blocked by a tree. So even though the light is shining, it's still dark, and those things promote opportunities for crime. And also just make people feel unsafe. So we're trying to work on how to improve the lighting in this community. We're doing a lot on building sidewalks. So if you ever make it over here, you'll notice that there are very few sidewalks in this community, and we are a high pedestrian community. So you'll see moms walking down the street, pushing a stroller, pregnant with a kid next to them, and they're basically in the street because there is no sidewalk, and that's a problem. So we're working on building more sidewalks in this community, especially connecting them to key places. Like we're currently working on connecting from the park that we have in the middle of the community to our community center to our area elementary school, more elementary. So at least there's a safe route to get to those. I'll go to workforce development. So workforce development, that's a program that I oversee. Currently, we do have a computer lab where we offer training such as resume writing, applying for jobs, interviewing skills, things like that. And then we also offer certifications. So we do custodial maintenance certification, where it's a 3-day training. People get certified as custodial maintenance, so basic entry-level thing. But we have currently a list of 11 partner employers in the community. So these are employers in the area who have said that we will commit to consider to hire your graduates. So what that means is that if they choose to apply to any of those 11 employers, I have a specific person that I can call and say, hey, so-and-so completed this training. They applied for your job. Please give them an extra look. And Moffitt Cancer Center is actually one of our partner employers. So that's really exciting there. Affordable housing. So like I said, rental prices are through the roof and our home ownership is very low. So we're trying to change that. So we have built single family homes in the community for home ownership. We've also we just broke ground on it's going to be a 61 unit apartment complex for low income housing. So it's specifically for people who are low income, and they're going to be able to live in this brand new, think of like the really fancy dorms on campus, where it's going to be brand new apartment. And then on the first floor, it's going to be programming space. So they're going to have programming from Prodigy, from Get Moving, the computer lab, all of that within their building. So again, we're really focusing not so much doing things just in our community center because it is a little hidden. A lot of people don't know about it, but more so trying to find ways to bring these services out and meet people where they are at. We have self-sufficiency programs. So these are more like case management programs where we work one-on-one with families to try to help them reach self-sufficiency, which ideally means they're able to provide for themselves. So they're not dependent on government benefits. And usually that involves either, getting further education, getting a better job. Some have become homeowners, business owners, things like that. We're working around things such as transportation, more so in being a voice to the community when it comes to transportation issues. So like I said, not a lot of people in the community have cars, and so they rely a lot on the buses. A few years ago, the bus stop directly outside of our community center was taken away. And why, I don't know, but there's many reasons. But it took us almost 3 years to get it back. And it was really frustrating coming from, again, I work in community engagement, whenever I'd be reached out like, hey, Diana, let's do this event to get feedback from community on what they need. And in my mind, I'm thinking we've done many of these events and the community keeps saying they want their bus stop back. So that's what they need. Like, what is the point in having more community events? We already know what they want. And eventually we were able to work our way in there to get that contact in heart and say, hey, the community needs this bus stop back. And it got put back. So it was really exciting. And then so we make sure that the community knows about all this, and we also get feedback from the community that then allows us to know like what kind of programs and services to provide through community engagement. So that's the other part of my job. So I oversee workforce and also community engagement. So that entails community events, so fun things for the community to engage in and come and meet their neighbors, do something fun. But then also there's that feedback and involvement of the community portion of it. So we do a community survey every 3 years. We host community conversations where we invite the community out for a night dinner and we present something that's coming either through our organization or just coming to the community as a whole, and we get their feedback and answer their questions so that they're aware of what changes are coming and how they can be involved and how it'll impact them. And then we also make sure to promote our things through flyers, social media. We do a mass text messaging system, things like that. And then our last thing that I'll mention is the coalition of partners. So that's our partners coalition. It's really for any organizations, businesses, people, students. You are all more than welcome to come. It's a quarterly meeting. It's actually taking place tomorrow here at the community center at 8:30 a.m. And it's more of a networking thing. You come, we have breakfast, we present things coming to the area, not just from us, but from other partners. And then you get to meet other people, and a lot of partnerships flourish out of that. And so really a lot of this work, while we do a lot, and in this community, a lot of it can't be done without partnerships. Next one. So how can you get involved? And I encourage you to get involved so you can volunteer with us. that is the website you can go to. It'll take you directly to the webpage for volunteers. And so we always welcome our volunteers for our Harvest Hope Community Garden. So we do have a community garden. It's open every Friday from 9 to 11 is the gardening day. So if you're available on that time, please feel free to come. It's an awesome, fun, casual environment, and you can walk away with free fruits and vegetables. We have a bunch of community events that you can volunteer at. Next Saturday, we have our annual Trunk or Treat Halloween event, as well as a Team Smile Dental Clinic that we're looking for volunteers for. And then now that we're kicking into the holiday season, we have all our holiday events. So those are all listed on there as well, and you can sign up for however many you want to volunteer for. Block by Block is more of a long-term volunteer opportunity for anybody who wants to get more experience really working one-on-one with residents and learning more about community outreach and doing that. And so there's a link on the website where you can fill in your information to find out when we're recruiting volunteers for future block. Paint the Town is our annual day of service, which a lot of these pictures are from where they're painting. It happens January. This year it's January 15th. And we just invite volunteers out, and you get put in a project. It's a community beautification project, and then you complete it, and then we have lunch, and yay, it's fun. And then the last piece is our Uptown Music Festival. So that is our annual jazz music festival that we have here, and we use volunteers for that as well. Next one. And here is this is my contact information. Please feel free to write it down. You can email me, and if you have any questions of how you can get involved, and if you are also looking for anybody to talk about college and careers and like what major do I go into, I have much experience with that because I didn't even know public health existed before I went into that major. I really did find it through like my experience at USF, and I am more than happy to talk about that and serve as guidance, because I know as first-generation college students, very often you don't even have anybody to turn to begin with. So I just want to point that out there, that if you ever have any questions, no question is silly, and you can feel free to reach out to me. That's it.
Great. Thank you, Diana. So I think the PowerPoint continues. What I'll do is we'll continue with Topher, and then we'll take questions. Well, actually, why don't I do this? Just since it's fresh on everyone's mind, any questions for Diana from our students? And the one thing that stood out to me, aside from all the amazing things that you do to serve the community, is oftentimes there's careers. So when I think about CDC, I heard a lot of various opportunity in terms of different types of occupations, right? I'm sure there's a lot of grants that flow through the CDC. So you need someone to manage all that money, and a budget person. You need social workers. You need public health professionals. Accountants, right? So oftentimes you hear a name and you think one thing, but to support that one organization, it takes so many people and various occupations. So that's something that I learned later on in life that I want to make sure our students understand, that never to kind of miss out on an opportunity, because oftentimes there's various occupations within one industry or one organization. So students, any questions in general that you have for Ms. Diana? Okay, so we're going to go ahead and move right into Topher, and then at the end we'll kind of close up with any final remarks. So let me go ahead and share my screen one more time.
Awesome.
And there we go.
Perfect, great. So disclaimer, I'm really not a slideshow person, so putting something together like this, somehow I've managed my whole career without having to give a full-on presentation. So here we go. So my name is Topher Larkin. I'm the LGBTQ+ and Marketing Service Manager. There's 2 titles in there. Later on, we'll get to how I'm actually transitioning into the other part of the title of this job. So it kind of follows the theme of just kind of creating something as we go along and finding what fits best for you. So next slide. Let's talk a little bit about Metro Inclusive Health. So Metro Inclusive Health, we are here in the Tampa Bay area. We have 4 locations. 2 are clinical and community centers. So that is over here. Our headquarters are in St. Pete. And then we have a brand new facility right in Ybor City, off in Nebraska and 275. It's the old German American Club. So if you're getting onto 4 and seeing it from downtown, this is brand new building that we have just opened about a month and a half ago. So we've been in the Tampa Bay area for almost about 30 years, started in 1992. And primarily the organization was founded through HIV care. When no one else was treating patients back in the day, Metro Inclusive Health kind of, stepped up to the plate, recognized, who was being affected in the community and was able to provide that care and support. And through the years, it kind of developed its partnership with another organization called CAN, which is a community access network, I believe, who kind of helped take care of the component of the health side of things. So that's including the primary care, all the kind of the technical health screenings and stuff, while Metro was kind of doing the community service care, the support groups, HIV testing, and the education component of it all. And then, of course, as healthcare and identities increase and develop, we've added the transgender component to our organization. Actually, the most recent updated stat is that, we started maybe at 64 trans patients, and now currently we're serving over 1,300 within the community. And that's offering HRT treatments, education support, mental health, all of that aspect of it all. Our organization, at any general time, we have over 100 programs going on, through various different, facilitations, groups. We are the second largest LGBT plus center in the United States. I'm not quite sure who the first is, but it doesn't quite matter because we are the second, and we are located here in Tampa. But once again, we range from primary care, yoga, behavioral health, HIV care and education. And I'll get into that in the next slide. But basically, whatever the community needs at the moment, we've got that covered, and that we're here to really get ourselves out there and showing that it is very inclusive care. We're reaching to the deep pockets of those who may not have had great experiences in healthcare before, or just have not had access to it. So we are being able to provide that and let people know that, there is an organization out there that is able to fulfill that need. Next slide, please. We'll kind of go from there. That's funny. I'm looking at my slides and not on the screen, so that's why. So as I said, we cover LGBTQ plus intensive care that ranges from group healthcare. Our professionals are very trained, so we know where people are at in the community and where they are in their lives, and how we can able to assess that into the whole holistic area of care. Counseling here, we have certified counselors who can write letters of support if people need to be on HRT treatment, and just kind of have a really great understanding of where people are coming from, as well as groups and all. Obviously, we have a sexual health background, so we are always advocating and normalizing sexual health as part of something that, it should be as synonymous as going to the dentist, going to the eye doctor, and, getting yourself, STI, HIV checked and maintained. We just want to have that normalizing conversation about it. Obviously, HIV prevention. So we like to come out to the communities. We go to you. We can come to schools. We can come to dorms and really provide the educational experience of it all. And as I said, once again, normalizing it and making sure that you're really being proactive about your health. And our wellness programs, as I said, ranges for anything from yoga, substance misuse, a lot of just community education. A lot of times people from the community come to us and are like, hey, have you ever thought about doing this or this? And we're like, great. If you're interested in doing that, if that's your passion and you want to be able to do that, we can put that on together for you. So we're always listening to what the community wants and needs. And then as well as just, throwing these different events, from the LGBT program, which I have been overseeing. It ranges from youth, which is ages 13 to 17, young adults 18 plus, and then our SAGE program, which is ages 50 or better. Additionally, there's trans services, there's outside the binary, so gender nonconforming, people who don't fit on the normal gender specters. We have that kind of program available. Next slide, please. Okay, so what do I do? What does my typical day look like here? So welcome to my gay agenda, which basically is a lot of things all meshed into one. We can go to the next slide too. So I kind of broken down what I kind of do, and these are kind of, as I had talked about in my intro. So I do not have a background in public health. I come from more the community side and communication. So I actually have a theater and communications background. So how did I land this job? How did I land this career? By luck, and also in the fact of just figuring out what I really wanted to do and how could I use that to my advantage. So basically managing things, which is actually a component of my job I don't necessarily like to do. I don't like to manage people per se, but I'd like to be able to work with others and to kind of have that cohesive background as far as being able to work with them and not necessarily have to dictate everything that they do, because I just believe that people should be able to run what they need to do and then get checked in every so often. But my job, it does entail managing people, managing the programs, the facilitators that come through, making sure that all the messaging is there, making sure that, that our programs are running as smoothly as possible. But one of my main things that I love to do is I love to be able to do this whole connection thing, as Jeanette was talking about earlier, about her passions of just kind of bringing people together. I think that is where the strengths of my career have led me into the fact that I'm actually that kid that wants to work with everybody in the sandbox, and that I would try to find ways to make that possible as much. I also enjoy the fact that I really enjoy trying to find those connections that you may not necessarily be thinking about, but bringing those to the table. So a lot of the times I do sit on different boards and committees, and they're always like, okay, like, how does this relate to this? So for instance, I was on a bone, American Bone Health had a council, and they wanted representation because there was nobody from the LGBT community or and HIV communities that could actually bring in some different studies and learning how to address things, the cultural competency of everything. So I really enjoy doing that, and I love finding community partners to just be like, okay, great. What are some fun things that we can do together? So things like partnering with the food and beverage industry for us to be able to provide testing, to the population, doing kind of different fundraisers and drives, and fun things that can bring awareness to this, to what we do, because sadly enough, the topic of HIV, a lot of people are still like, wait, that's a thing. And it's like, I thought this was something back in the 80s, back in the early 90s. And yes, it still is a thing. People, as I've been seeing 18-year-olds, who are still getting diagnosed positive. And while it's not a death sentence these days, with proper medication and having that regime of it all and becoming undetectable, meaning that your virus has been suppressed so much in your body through medication that the likelihood of transmitting it to somebody else is basically slim to none. So these are the type of things that we want to get that education out into the community and letting people know that, it's still an issue. Yes, it's a taboo subject, both following, the HIV conversation, sexual health, and also sexuality. So sometimes it's not a fun thing for others to hear about, or they're just like, oh, no, that's not for me. But, these are the type of things that I try to relate in the messaging of what we do. And then also I sit on this marketing side of things. So that's where the additional part of the creativity flows from. I like to call myself this cultural broker in a way, to be able to look at something and be like, okay, how can this relate to what we're doing in the community, the messaging that we want to give out, and is that really working? So it's like establishing relationships with partners, finding like right now, I really enjoy trying to connect with the local arts organizations and how that relates back. Because knowing that, the LGBT community supports the arts, it goes hand in hand with a lot of different other things. So I just try to find all those ways that we can really loop it all in together. So for instance, I'm also helping planning this LGBT prom that is being developed to give the opportunity for youth. I also am in charge of our DEI training sessions. While I don't do the facilitation, I help and do the bookings and kind of let organizations know, hey, this is available for your organization. So it's really about increasing the visibility and the services that we can do to others. So that's kind of the marketing side of it all. Next slide, please. Just different ways that people can get involved. So we have our social groups. So if you want to actually join one of our groups, if you feel, if you are LGBTQ plus and ally, want to kind of be in that like-minded space, we have different organizations. As I said, there's Young Adult Socials, there's City Mix, which primarily focuses on sexual health topics, but also kind of relates to, what's going on in the world around people. Volunteering, of course, as a facilitator or volunteering your time. Ironically enough, me getting involved in this particular type of field started off with me actually just volunteering in the community because they needed help with a project for their World AIDS Day Vigil. And I was new into town and was like, hey, I can offer my skills and services. And through that is kind of how this whole career developed and how I was kind of getting involved in health and public health and community and really kind of being this champion of advocating for those whose voices are not necessarily heard or not necessarily being brought at the table. And then additionally, one of our new fun projects is Metro used to have a thrift store, and now it has turned into this kind of high-end, I kind of call it almost like our museum gift store in a way, where it's part coffee and tea store, part retail, part workspace, but also there's a clinic space in as well. So people can kind of be in this environment. And once again, the topics of health and sexual health have been normalized. There's access because the store is open till like 9 o'clock, sometimes 10 o'clock on the weekends. So people can come after hours to get HIV tested, to kind of connect with their primary care, and just kind of be in this environment. Next slide, which is my last slide, which is basically just about how you can find out more of Metro. For USF students, we are definitely on campus at the Bull Market. So definitely come by to the table to visit. I know I'm personally working on a project called Project Condom with USF, hopefully in the spring. It's going to be a competition of making an outfit using primarily condoms as materials that we donate and give you all. So a lot of fun things where, we're trying to get people educated, excited, and bringing that awareness in fun, new, and innovative ways. So that is kind of my spiel in a nutshell, since I know we're slowly running out of time.
Great. Thank you so much, Topher. And again, we'll open the floor to any questions students you might have of Metro Inclusive Health. And Topher, one thing that stood out to me is the slide that you showed in reference to in your work. You're managing people, you're connecting with the community, you're collaborating with a lot of partners, and marketing all the various services that you all provide. So one job having a multitude of various experiences that you get from the position that you have, and oftentimes those skill sets are transferable, right, to other opportunities that might come along. So just great message for our students to hear.
Definitely. And also just to add upon that is like, yeah, don't let that kind of define you. And also, when I was looking for jobs, it was very hard to kind of fit, when you're filling out applications, when you're finding things on LinkedIn, you're like, what category do I fit in? Because this isn't necessarily me. So sometimes you have to really hone in on those skills. And sometimes you have to just kind of like, not make up a role, but like, to kind of define what it means for you. And that's how you can kind of market yourself to future employees.
Yep. So students, any questions for Topher? And I appreciate how you all have shared volunteer opportunities, right? Because it's all about kind of seeing it, that when you see it, it kind of makes it real and it starts to connect. So I think it's wonderful to take advantage of these volunteer opportunities. So why don't we do this before we close out? Why don't we go around one last time? Any last words of advice for our students who, as you heard, some are figuring out what it is that they're going to do next. Some are on their path already. So Topher, we'll start with you. Any last words of advice?
Yeah, last words of advice is just kind of, once again, finding what you're good at, finding what you really want to do, and trying to apply that to the jobs that you do. And if you don't, sometimes people will, they'll take a job because they need it, but also figure out how you can use that to your advantage, whether it's still something supplementing thing in your personal life, or trying to bring that to the job so you can change it to make it, what you want. Your reputation will go far, and who you're collaborating with and the skill sets that you bring. So when it's your time to shine, and when you really feel that, that this is like your strongest suit, then let it shine and let the work speak for it.
Great advice. Diana?
So I'll go more of like your classes route. So just because I know that, like, if I think back to me as a freshman, I wasn't even thinking about my future career yet. I was like, let me just graduate, like get through these next 4 years. And I didn't even know what I wanted to do. So my biggest piece of advice is, if something interests you, outside of your classes, please like get involved. So if I remember when I was in school, I was part of the Latin American Student Association. I was in a sorority. And while some people think like, oh, well, how does that help? The opportunities that you enroll in, find ways that they'll help you in the future. So I got really good at event planning and event coordination and reaching out for donations and things like that. So your outside of classroom experience are just as important as the ones in class. But also when you're choosing classes, remember that you have like these general education courses that you have to take, like humanities and your sciences and all of that. So if right now you're in an undecided major that allows you to, like, you're not confined to specific classes you have to take, pick classes that interest you. You'll have friends that tell you, oh, this is a real example, take Survey of Jazz. It's super easy. Yeah, I took Survey of Jazz and I hated it because I hate jazz. And it didn't help me. And yeah, I got an A, but it was awful going through it that semester. So instead, following semester, I picked classes that actually interested me. So I remember I took a class called Racism in American Society. And just those types of experiences then kind of help you find your way into what you're actually interested in. And like Topher said, a lot of times, not all careers are like perfect path to getting there. So really just finding out what it is you're passionate about, what you're good at. When it comes time to find a career, you'll be able to say, these are my skills. This is my skill set. And this is the area that I'm interested in. Like, let me now find a way to get my foot in the door there.
Great. And Janet, go ahead and close this out. Final words of advice.
I'll just put it all together in a nutshell. And what everyone has said is basically find out what you're good at and follow your heart. And once you follow your heart, and you'll start seeing the ways that you need to go. And always ask for advice. Ask for advice, to talk to people and find out how they get to their positions and everything. But when you follow your heart in that way and you ask a lot of questions, that's the way to go. Thank you, Ray.
Thank you all so much. So round of applause, virtual round of applause to Janet, Diana, and Topher for the work that they do. 3 amazing organizations, and I'm glad that they brought their message to us alongside the opportunity that are available. Students, just some final notes. There is a survey in the chat. Please make sure that you fill that survey out. So on behalf of undergraduate studies and the 2021 Majors Expo, I'll close out with saying, Janet mentioned one step at a time. And I know, these are definitely some stressful times that we're living in. And we always try to rush to figure things out, and that sometimes the exploration piece of it is okay as well. That through the learning, through the figuring it out, you get to a better place of understanding. So Much success to each and every one of you. Best of luck to you. Continue good health to all, and thank you all for being here with us today. Enjoy the rest of your day, everyone, and hopefully see you all soon.